Dr. Parcellis, yes. Why do you think doctors are leaving medicine? It's like apparently pretty common now. I actually have 2 or 3 friends who they themselves have left medicine. I think when we went into training about 15, 20 years ago, the traditional idea of a doctor is very different than it is today. And so I was inspired by seeing my father and the way he built his practice, and that it was built on traditional values of like providing services for people in the community. And when I went to medical school, we paid a lot of money to go to medical school. A lot of my friends took out tens of thousands or hundreds of thousands of dollars of loans, and we forfeited, sacrificed so much in terms of our own personal time. Like I didn't really have my 20s and my early 30s because I was in my training, both medical school as well as my residency. And then I started my family in my early 30s. And so I just like didn't get to socialize and travel and do all those things that a lot of people at that age got to do. But I think we were told that if we do these things, like we take out these loans, we give up our, some of our prime years, our 20s and our 30s to be in training, that when we finish, we will be a valuable member of society. We will be able to have meaningful interactions with patients, and we'll be able to enact like empowering change on other people in our community. And I think medicine has shifted so much more into a corporate structure, and the value add that we were sort of promised is gone. And so a lot of my friends just complain of burnout. They complain that they feel like they are given too much responsibility. They are not given enough support, whether it's having like other staff members, medical assistants, physician's assistants. Like one of my friends is a very busy surgeon, and her PA went on maternity leave, and the hospital did nothing to like support her, give her any sort of help. So she was without help for the last 2 months of that woman's pregnancy, as well as 6 months. So almost 9 to 10 months without the help of staff, but given the same or even more load in terms of clinical responsibilities and other responsibilities. And then I think the pay just isn't as good as it used to be. Like reimbursements are going down. Physicians aren't being reimbursed the way that they used to be. I mean, I remember my dad coming home having a letter that said, "Dear healthcare provider," and it was no longer addressing him as a physician. And so you expect some of the brightest and most talented people to pursue a career in medicine, promising that they're going to be adding a tremendous amount of value and that the sacrifices are going to be worth it. And then while we're in the middle of our training, the whole structure changes and you pull the rug out, and then yet we're still expected to, put forth that effort, but there's no reward. Like you're unhappy, you quit your corporate job working as a hospitalist or, as an employed physician, and nobody cares about you, or they just change up your support structure, take away physician's assistants, add people you don't know, you don't really have any control over any of that. And then you're like, what's the point? Because I don't even feel like I'm helping patients in a meaningful way, the way I'd like to be able to help patients. So I empathize with all of my friends who are in those situations, and I commend them for valuing themselves and saying, this is not fulfilling me and I'm unhappy and there's more life, because I think these conversations need to be discussed more. And if it's going to get better, we need to start talking about it.